Hello, my name is Professor Michael Kidd. I'm Deputy Chief Medical Officer with the Australian Government Department of Health and Aged Care. Today I want to talk about masks. As you know, masks are no longer mandated except in certain high-risk settings like hospitals and residential aged care facilities. But they're still highly recommended indoors in those situations where physical distancing can be difficult. Back in the early days of the pandemic, before we had effective vaccinations, a well-fitted mask was a critical piece of personal protective equipment, or PPE, serving as a physical barrier to COVID-19, especially protecting frontline healthcare workers, and they still play this role. But now, in our third year of living with COVID-19, masks also play a key role in reducing the risk of transmission. After all the hard but necessary public health measures, including lockdowns, contact tracing and border closures, we find ourselves in a different space today where we are learning to live with COVID-19. But it doesn't mean that the risk has gone away. And it also doesn't mean that we can ignore the serious impact that COVID-19 continues to have on many people in our community, especially those at high risk of severe illness. Around 500,000 Australians are living with compromised immunity, and more than 4.2 million people are aged 65 and over and at increased risk. So if you're a loved one or in either of these groups, COVID-19 can be much more than a mild illness that resolves in a week. It can become life-threatening very quickly. Last month, the Australian Health Protection Principal Committee, the AHPPC, recommended wearing a mask outside your home whenever in crowded indoor environments, including on public transport. This is important to protect yourself and to protect others, and the recommendation is backed up by significant, robust scientific evidence. And it's a view that's shared by my state and territory chief health officer colleagues on the AHPPC. At the end of the day, it's now your choice whether to wear a mask in most situations. It's only a minor inconvenience that could well save a life. So please keep a mask handy and think about putting it on next time you're in that crowded indoor space, a busy supermarket, waiting in a queue, catching an elevator, or heading home on public transport. It might just be what stops you from catching COVID-19, but also stops the person in a high-risk group standing nearby from catching it too. Take care and thank you for watching.